Hi everyone, welcome back. I'm Rabeea. Now, today we are discussing another topic that is diabetes. So, let's discuss about it. So, the learning outcomes, for basic one learning outcome one that we are discussing the basic anatomy and the physiology of the long term health conditions. And each week we are discussing the basic anatomy and their long term health conditions. And in this week, today we are discussing about diabetes. So, let's start. So what's the diabetes is, what are main systems, types, what are mean by it. So let's see. Actually there are two types of the diabetes that type 1 and type 2. So let's go first of introduction, then we will discuss this. So we will look today about the types of diabetes, what are the causes of diabetes, symptoms of diabetes, and the management of diabetes according to NICE guidelines. So let's see. What is diabetes? Diabetes is actually a health condition where the body cannot produce or properly use glucose sugar for energy, leading to high levels of glucose in the blood. It means in diabetes, the person has high amount of glucose, that means sugar in the blood. And this state is called as hyperglycemia. There are two types of the diabetes. If the person is diabetic, it can be happen that the person has type 1 or the type 2 diabetes. So let's see what these are. So type 1 diabetes is occurs when the body doesn't produce insulin, that is a hormone needed to allow glucose to enter the cells, and it's actually an autoimmune condition, and it's usually prevalent in childhood. While the type 2 diabetes is prevalent in adult age or not specifically not in the childhood, and it's not specific like type 1. It's a little bit different. And what happens in type 2 diabetes is that the body doesn't use insulin properly and or may not produce enough insulin. Now, what you are thinking, what is insulin? What I'm discussing insulin. Insulin is actually a hormone released by our organ called as the pancreas. Later on in the slides, I will show you how the pancreas look like, where it is located. And actually what this insulin do, it's acts like a key, a gateway, a channel that helps the glucose to enter inside the cells. So without insulin, our glucose cannot enter inside the cells. So insulin actually acts like a key, basic key of a door to enter inside the cell. And why this is required, if the glucose not goes inside, our body cannot produce the energy. And our body use glucose to produce energy. Otherwise, the body cannot produce energy without the presence of the glucose. So actually that's the importance. So here's the picture I'm showing you to make you the concept clear, to give you an idea. So see, imagine this key is the insulin. So if this key is not functioning or our body is not producing, how glucose can enter, unlock the door and can enter inside the cell. That is actually happening in type 1 diabetes. And why we say it's autoimmune condition, it really happens that the body immune system that misread own body structure as a foreign particle or a foreign structure and kill that part. So that is called as the autoimmune condition. While in type 2 diabetes, what's happening? Either the key is defected, that means insulin, or not enough producing, or the insulin is normal amount available, the key is there, but there is a problem in the lock. There is no enter gate of the key. So that is happening in the type 2 diabetes. And this lock is actually a receptor. In our terms, it's called as a receptor of the cell. Here is a nice video link I'm sharing with you. So please, in your free time, watch this video, click this link and watch. That's really helping and guiding for you to understand this concept. Now I'm showing you the normal stage of the health condition without diabetes, how insulin works.
foods, milk and some dairy products, and fruit. This glucose then moves into the bloodstream, and the body detects that the blood glucose level is rising. In response to that, the pancreas, which is a little gland that sits just underneath the stomach, starts to release a hormone called insulin. And it's insulin that helps our body get the energy from the food we eat. The bloodstream then takes the glucose and the insulin to every cell in our body that needs it. To make this easier to understand, let's look at muscle cells. At the muscle cells, it's insulin that allows the glucose to get into the cells where it can be used for energy. It's a bit like insulin is a key unlocking the door to the cells so the glucose can get in. That way, the blood glucose level starts to drop. But the blood glucose level can be topped up at any point by the liver releasing extra glucose that it has stored. The blood glucose rises again, and again the pancreas produces more insulin to move with that glucose through the bloodstream to the muscle cells, open the doors and let the glucose in. The body functions best with the blood glucose at an optimum level. It doesn't like it if the blood glucose rises too high.
So I hope your concept got clear about how the insulin functions to manage the glucose to enter inside the cell to produce energy. Now let's discuss some basic anatomy and physiology now. So what are the pancreas? Pancreas actually are the organs that is present in our abdomen lower area, and it's present behind the stomach as you can see in this picture. Let me show you more clear in this here in this slide. So see, it's connected, it's behind the stomach, it's a longitudinal type that's arising from the right side towards left. And inside the cell, it's made up of multiple cells. One of these cells called as the beta cells, and these beta cells actually are responsible to release insulin hormone. And these cells can be seen through and under the microscope. So pancreas is an organ that's located behind the stomach. And it's actually an endocrine gland as well as exocrine gland. It means that the gland that releases hormone is called as the endocrine gland. Exocrine because it also releases some digestive gland, juices that helps in the digestion. Next is beta cells. I already described you when showed in the picture. These are the small, tiny microscopic cells. These are actually called as the clusters isles of Langerhans. Among these, specific beta cells produce insulin hormone, while other produces different hormones. But today is not that topic. That's why I'm not telling you. Otherwise, they release other hormones as well. For example, alpha cells release glucagon. Now let's discuss the role of the insulin, what insulin function is. As you also watched in the video and we discussed before, insulin plays a very important role like a key of the door that helps the body to use the stored glucose to enter inside the cell to produce energy. In this way, it regulates the glucose balance inside our body, either to absorb or store. If the insulin deficiency happen, it means it's a disease condition. In type 2 diabetes, what's happening? The pancreas produces little or no insulin or defected insulin. Specifically, this happens in type 1 that there's little or no insulin happening or the body cause as autoimmune reaction happening, destroying its own insulin. And then in this condition, there is only one treatment is present that is called as the insulin injection. That means the artificial insulin the person is taking. So glucose regulation is monitored is occurred by the insulin that helps to lower the glucose level in the blood. If it not functions, then the glucose levels high in the blood and not entering inside the cell. Now let's discuss the differences between the type 1 and type 2 diabetes. So we all know that in type 1 diabetes, autoimmune destruction happening, that the body cells identify these better cells as a foreign particle and destroying them. And in this result, less or no insulin producing inside the body. And in this way, it's causing the insulin deficiency or at least all no insulin inside the body. And we know then the treatment option remains is only alternative take insulin from outside through as insulin injection. While in type 2 diabetes, what happens? Insulin is defected or get affected or the insulin resistance happen. Fourth is insulin resistance means that the body cells become resistant to respond to insulin. Insulin is there, but cells are not responding. They are not identifying insulin. And that's usually happen because of the high cholesterol, obesity, and the other different other factors. Or the other reason can be happen that beta cells dysfunction, not functioning properly, producing defective insulin. The treatment options here are available, that the hypoglycemic drugs, that's the oral medicines, sometimes insulin injection needed if it's still uncontrolled. And the good thing is that it can be controlled and managed through the lifestyle changes as well, through exercise and diet, less sugar intake from the diet according to NICE guidelines, if followed, then fine. If it is still not managed, then the medication and insulin are the options in simultaneous with the healthy lifestyle changes. What are the signs and symptoms of insulin? The signs of the insulin is the polydipsia. It means feeling excessive thirst because body wants to balance the blood pH as there is high level of glucose, and that's result to polyuria as well, excessive urination. That includes nocturia, that's mean nighttime urination. That also causes the excessive weight loss, and this high blood glucose levels affected the other parts or the organs and the system of the body, such as on the eyes, and causes the visual changes. Nephropathy, neuropathy, that's mean on the nervous system is affecting numbness. These such people feel so much frequent tiredness, that means lethargy. And whenever they easily get the wound or got wounding, especially the end part of the end organs or the end parts of the body, for example, toe, nails, and that have the chance to get gangrene and you really get then amputated. It's mean removal because these are the resident sites of the bacteria. Because of hyperglycemia, because of the glucose, bacteria are growing and not going off. That causes the then gangrene infection. And repeated infections, that's the result of frequent in such people. So these are the differences that we discussed between the type 1 and type 2 diabetes. Here I advise that there are some activities pre and post on the Moodle. Please go and do these activities, watch the video, and there is one challenge for you to do the poster competitions, who makes the best. So please go and post and upload your poster here. And what the impact of the diabetes occur? Let's discuss across the UK. Today there are almost 3.6 million people who have been diagnosed with diabetes in UK, and it's estimated that their frequency is increasing in next year, and 10% among them identified with the type 1, while the 90% remain with the type 2. It means it is modifiable. We can control or manage beforehand. So in this way, we can reduce its onset or can delay by managing and improving our lifestyle and the dietary health conditions and with the proper sleep. So next is about the complications, that what the complications can happen if the diabetes is not controlled. So early deaths, it's over the 460 deaths that happening early because of the complications of the diabetes, and because of the frequent infections, amputations, because of the gangrene, over 140 limb amputation cases identified in UK, and over 1850 people experienced heart attacks of the heart failure because of it, and 540 people experienced strokes, and 270 people with the renal placement therapy because it also affects our renal system as well. Eyes, neuropathy, nephropathy, neuropathy. So I hope this lecture make you a lot of awareness and you studied about the diabetes, the basic knowledge, and advise you to go further in detail and reading in this week from the module. Thank you.